Hi Rob, this is Emma Nieves, and I'm the student physical therapist currently working with Miss Brown in room 213 at Intermountain Park City Hospital. Her date of birth is November 19th, 1968. To contact me, you can call me back at 443-632-6618. I'm calling today because Miss Brown has had a change in her healthcare status. Miss Brown has been very responsive and upbeat throughout her recovery from her ischemic stroke. However, I noticed that while I was testing the strength of her upper extremities, Miss Brown's respiratory rate increased quickly and she became out of breath. Miss Brown was brought to the ER yesterday and was admitted for an ischemic stroke affecting her right side. During my assessment today, I noticed she became out of breath as well as had an increased respiratory rate. I stopped my assessment immediately and instructed her to relax and take deep breaths. Her heart rate continued to increase, but her blood pressure remained stable. The patient has had a history of asthma and mentioned leaving her inhaler at home when she was brought to the ER by ambulance. After my assessment earlier, I became concerned with Miss Brown becoming short of breath, and it was not a normal outcome with the test I was performing on her. I'm very concerned Miss Brown may have an issue with her lungs, and I'm going to hold off with her physical therapy until you are able to see her. Will you please assess Miss Brown as soon as possible and follow up with me once you have run some tests and have a clearer idea of what is going on? I will be in contact with you by the end of the day if I haven't heard back anything. Thank you so much for your help, and we'll talk soon.